Hello everyone, in this video we are going to discuss about Actinomyces and Nocardia. So coming to the Actinomyces and Nocardia, these two are gram-positive branching filamentous rods. So what is the differentiation between these two organisms we will see in this video. So first, the two main differentiating thing between this Actinomyces and Nocardia is acid-fast staining. Actinomyces is not acid-fast, whereas Nocardia is weakly acid-fast. Whereas Actinomyces is anaerobic in nature, whereas Nocardia is aerobic. And Actinomyces is also a part of normal oral flora, whereas Nocardia occurs in soil. And coming to the infection, Actinomyces will cause oral and cervicofacial abscesses. So we can see a lumpy jaw in this Actinomyces infection, whereas Nocardia will cause infections of pulmonary, CNS and cutaneous infection, especially seen in immunocompromised conditions. The next main differentiating feature is the sulfur granule production. Actinomyces will produce yellow colonies and there is sulfur granule production, whereas it is rare in Nocardia. So coming to the gram staining, there is a blue-purple filament and no acid fastness, whereas Nocardia, with modified Zn staining, that is acid fast staining, it is positive. So coming to the risk factors, for Actinomyces, dental trauma and poor hygiene are the risk factors, and for Nocardia, immunosuppression like intake of steroids or in case of transplantation, these are more prone for Nocardiosis. Treatment for Actinomyces, penicillin is the long course of penicillin is the treatment, and for Nocardia, trimethoprim with sulfamethoxazole is the treatment. So whenever we see a question, we should always look for lumpy jaw, that is anaerobic condition, and sulfur granules production in Actinomyces. In Nocardia, whenever we see a question with brain abscesses in immunocompromised and acid-fast gram-positive branching filaments, we should always look for Nocardia. So in this picture we can see Actinomyces and Nocardia and gram staining. They are long, they are gram-positive branching filamentous rods. So we can see the branching pattern differentiation slightly between the Actinomyces and Nocardia. It is long branching pattern in the Actinomyces, whereas Nocardia there is short ones. There is one important phenomenon we should always look for, that is Splendore-Hoeppli phenomenon. It is nothing but eosinophilic material, that is there is an antigen-antibody complex around the pathogens. It is generally seen in chronic granulomatous infections like Actinomyces, sporotrichosis and schistosomiasis. So there will be radiating pink club-shaped material around the surrounding organism because of this antigen-antibody complex, and Actinomyces will, with the sulfur granules production, will show the Splendore-Hoeppli phenomena. So whenever we see a case of jaw mass with draining sinus, sulfur granules, eosinophilic material around the bacteria, that is Splendore-Hoeppli phenomena, we should always think of Actinomyces with Splendore-Hoeppli phenomena. So these are the important points in Actinomyces and Nocardia.